If you experience any of these signs while you are pregnant, it might mean the life of you and your baby, which means it can make you undergo abortion and it can even take the life of you as a mother. And that's why you must pay close attention to everything I'm going to be explaining in this video, so you can know them. If you're pregnant or if you're planning to get pregnant, you need to watch this video to the end so you can take note of all these signs and symptoms I'm going to be listing out, because these signs and symptoms have been the major things that have caused the life of so many women and so many unborn babies. Now, one of the major signs you might take note of, or one of the major symptoms you might take note of while you are pregnant and you must report it to a healthcare provider is bleeding. If you experience bleeding while you are pregnant, it's not normal, please. Now, there is a difference between implantation bleeding, and implantation bleeding happens within the first 2 weeks of pregnancy. But when this bleeding becomes so much, you need to visit a healthcare provider so they can check you to know the major cause of your bleeding. The other thing that might cause bleeding while you are pregnant is ectopic pregnancy, which means your pregnancy might be happening in your fallopian tube mostly. When pregnancy happens outside the womb where it's supposed to happen and it's happening in a different place, which is the fallopian tube, you might experience so much bleeding while you are pregnant, and you need to visit a healthcare provider because ectopic pregnancy can be life-threatening. It can take the life of you, and it might mean you will not keep your pregnancy to term. And that's why you must visit a healthcare provider when you experience any of these symptoms I've just listed out. Now, the other thing that might cause bleeding is placenta previa, whereby the placenta covers your cervix. It covers the neck of your womb. When it covers the neck of your womb, that means you might not deliver your baby, and that pregnancy will not grow to term. And that's why you must visit a healthcare provider so they can know the solution for your problem. The other thing that can also cause bleeding while you are pregnant is placenta abruption, which means the placenta have separated from your womb. When the placenta separates from your womb, that means your baby will no longer have access to nutrients, access to oxygen, which will keep the baby alive, because the placenta is the major organ that supplies the baby with nutrients, with oxygen and other stuff that can keep the baby alive. So you need to visit a healthcare provider so they can check you to know what is causing your bleeding while you are pregnant. There are so many things that can cause bleeding while during pregnancy. Cervical polyps might cause it when there's a growth on your cervix. Cervicitis, inflammation of the cervix, can cause bleeding while you are pregnant, and that's why you must visit a healthcare provider. Infection can also cause bleeding while you are pregnant, and that's why I said bleeding while during pregnancy is not normal. It's not normal at all. In fact, during pregnancy you need much blood, because you are no longer supplying blood for you yourself alone, but you are supplying blood for you and your baby, your unborn baby. So you need to visit a healthcare provider. You should not be losing blood while you are pregnant. The other symptom you must always pay close attention to is seizure. If you're that kind of person that's always experiencing seizure, convulsion, you are shaking every time as a woman, and you think it's a normal thing, or sometimes you think it's a kind of spiritual, stuff like that. It's not spiritual. Please, you need to visit the hospital. It's an abnormal sign you must pay close attention to during a pregnancy, because it might mean you are having eclampsia or preeclampsia. When you are experiencing fast breathing, you are always breathing so fast, it means an abnormal sign. It might mean your heart is having problem. And when your heart is having problem when you are pregnant, it means your baby will not have enough supply of blood. The heart will not function very well to supply your baby with blood, and you yourself, it might place you at risk as a mother. And that's why you must visit the hospital if you experience this fast breathing while you are pregnant. If you experience swelling of your legs, swelling of your feet, swelling of your face, swelling of your hands, you need to visit the hospital. Now, it is normal for you to experience some kind of little or mild swelling, because when you are pregnant, the heart is unable to pull up blood or to discharge blood the way it should while you are pregnant, because there might be some kind of restrictions due to your pregnancy. It might be restricting some kind of blood vessels, pressing against them. But once this swelling becomes abnormal, it becomes so severe, your legs are just swelling up anyhow, your face is just swelling up, your hands are swelling up, please visit the hospital so they can check you and offer a solution to you. Now, when you are pregnant, you might experience some kind of mild abdominal discomfort, because there might be some kind of changes in your abdomen. The baby might be growing, the baby might be kicking sometimes. It's normal. But once this pain becomes so severe, you start experiencing so much cramping in your lower abdomen, it might mean another thing, and you need to visit a healthcare provider so they can check you to know what is causing that particular abdominal discomfort. Now, if you're always feeling dizzy, you are having blood vision, you are having so much headache when you are pregnant, I beg, run to the hospital, because it's a danger sign. If there's a reduction in baby movement, the baby is no longer kicking, the baby is no longer moving, there's a reduction, or maybe there's no movement at all in the womb when there was movement before, then you need to visit the hospital, because it might mean another thing, and you need to visit a healthcare provider so they can check you to provide a solution to you. So after watching this video, if you have more questions you wish to ask about this particular topic, please do well to drop them in the comment section so I can respond to you as soon as possible. And don't also forget to subscribe to our channel so you can get more amazing videos like this. Thank you for watching this video. I'll see you next time.